So, in a Viva question, we'll be discussing today that what is the definition of this acute liver failure, and what is hyperacute, what is acute, and what is subacute liver failure. Now, to call it as liver failure, we must understand that it has to be liver dysfunction. So, the acute liver failure is defined as it is a clinical syndrome. So it is a basically clinical syndrome where there is definitely dysfunction of liver, and where this liver dysfunction can be seen through coagulopathy, because this is one of the most important function of the liver is coagulopathy, and encephalopathy that usually follows after presentation of a liver dysfunction, and that is evident by most of the time jaundice or by raised SGOT and SGPT. So this is what is the definition of acute liver failure. That is, it is a clinical syndrome where there is liver dysfunction signs, and mostly it is evident by coagulopathy and encephalopathy. Now, to know a coagulopathy, we know that we can do a PTT test. The normal should be uh, around 30 seconds. So if it is deranged like 40, 50, 60, 80, it can be depending on the coagulopathy. And the second thing is INR, which is actually the prothrombin time. Normally it should be 1. The prothrombin time is usually normally is 15 seconds depending on the lab. So if it is 30, 45 means the INR is raised, means there is coagulopathy, there is increased risk of bleeding. And encephalopathy, we grade it via West Heaven criteria, and it is graded into 0, 1, 2, 3, 4, where 0 is minimal and 4 is comatose stage, where 3 is semi-stuporous state, and 2 where there is marked confusion, disorientation with time and place, and there is marked confusion, whereas in 1 usually the patient can talk well, but there is slightly abnormal behavior and there is abnormal sleep awake cycle. So these patients tend to sleep at morning or day, and they remain awake during night time. So this coagulopathy and encephalopathy that has to occur after the jaundice or after the liver dysfunction. So the must is jaundice or derangement in the liver function test, which is actually followed by coagulopathy and encephalopathy. So this acute liver failure can be hyperacute or acute or subacute. Now, hyperacute means the liver failure sets very fast. That is the reason why it is called hyperacute. Very fast means what? It is usually within 7 days of the jaundice or derangement of SGOT and HGPT. So the patient presents with jaundice or derangement in liver test, and if the patient develops coagulopathy and this encephalopathy, it means the patient is hyperacute liver failure. If this duration is between 8 to 28 days, means around a week to less than a month, we call it as acute. And when it is more than a month, means it is more than 28 days, up to 3 months or 12 weeks, we call it as subacute. Now, what is the best example for this? Hyperacute, most of the time it is seen in poisoning. For example, paracetamol toxicity, it's extremely common because of the large dose of, we know 8 gram of paracetamol is lethal, and those patients who have CLD or alcoholic, 4 gram also can be lethal and can be detrimental to the life. So paracetamol poisoning is one of the best example for hyperacute liver failure. Hepatitis A is one of the most common cause for acute liver failure, and ischemic liver disease. So whenever the patient has right-sided heart failure, and that can be because of the IVC thrombosis, right atrial pathology. Whenever there is this ischemic hepatitis, then they present as hyperacute liver failure. Whereas In acute, what examples we have is hepatitis B, and the most drugs like NSAIDs or the hepatotoxic drugs like mm, teicoplanin or polymyxine, or most of the antibiotics, most of the analgesic drugs usually fall into this acute liver failure disease. Whereas this subacute, most of the time we have some drug which can cause the subacute liver failure. Now, why do we need to understand? Because in this hyperacute liver failure, cerebral edema is very, very common. Cerebral edema is very common. Whereas in acute liver failure, cerebral edema is common, but it is compared to less common compared to hyperacute liver failure. And in the subacute condition, the cerebral edema is pretty less common, it is kind of rare. So, usually hyperacute condition, if it is treated aggressively with utmost care, the prognosis of this condition is pretty fair, but the prognosis is poor in acute liver failure. And as we know, this in subacute condition, as the disease actually worsen over a period of time, most of the patients usually have ascites or renal failure. It is also very, very common in this subacute liver failure. The prognosis of these patients is usually poor because this patient actually worsen over a period of a month or two or three. So this is in short about the acute liver failure when we compare it with hyperacute versus acute versus subacute liver failure.